People right now that have healthcare are not going to have healthcare anymore. It looks like approximately 4.8 million people could lose all health insurance coverage in 2026 under these current conditions.
This is Secrets for Success.
Welcome to the Secrets for Success podcast. I'm your host, Greg Todd. Thank you, as always, for joining me. Today, I want to talk about a discussion, a conversation that I had with a few clients over the last couple of days. So the last couple of days, I've had 9 businesses, 11 clients here at our Skyview retreat spot. And we have been helping them with creating one-to-many ways for them to be able to sell their products, their offerings, in this case, particularly their book. So I've helped all my clients write a book on what it is that they're an expert at. And we've used the last 3 days to help them with promoting their book. So with that said, there's so many different types of people here. We have practice owners. We have, regular clinicians who are trying to go into business. We have online business owners. We kind of have them all. But in what I want to talk to you about right now is from 2 practice owners that I was talking with. And I feel like this is something that I need to share with you all as well. This is something that recently has happened, and I'm sure you all have either directly or indirectly felt it, but we've had a shutdown in the government for over 40 days, which it looks like it is coming to a close. And with every good thing comes a potential bad thing. And so the government shutdown is no longer going to be a shutdown, but I don't know if people understand what is coming of this shutdown ending. What they were fighting on was the Affordable Care Act. And right now in America, 24 million people basically use ACA. Okay, they use the marketplace. And there are subsidies that are set to expire at the end of 2025. And those subsidies were potentially going to stay, and the Republicans basically want those subsidies to primarily go away. Okay. So that was part of the big, beautiful bill. All right. So anyways, this is not to get political, but this is what's happening. And I'm not here to say who's right, who's wrong. What I am here to say is, look, this is what's going on, and this is how it's going to potentially affect you. And what the heck are you going to do about it? Now, what I hold in my hand right now is the book, The Clinician's Guide to Multiple Income Streams. And it's practical strategies for building memberships, courses, group programs, and offers that scale, primarily for the healthcare provider. When I wrote this book, I truly wrote this book to help you guys build multiple income streams. That's what I wrote the book for. And I wanted you to be able to build multiple income streams that don't rely on you having to physically be in front of someone, because that is the income stream that most of you are primarily relying on right now. But now, here we are, and we're dealing with this ACA issue. Here's what is going to happen as of January of 2026. People right now that have healthcare are not going to have healthcare anymore. It looks like approximately 4.8 million people could lose all health insurance coverage in 2026 under these current conditions. And basically, the 24 million people that have ACA, it might even be more than the 4.8 million that are not going to even carry healthcare insurance at all. It's going to go up so much more. It looks like premiums for many of the enrollees could more than double. Okay, if the subsidies expire, which they are. And for still covered individuals, the risk pool worsens, which means that the prices are going to go so much higher. So the reality is this, guys, you're looking at like maybe 10 to 12 million people that have health insurance are not going to have health insurance. So the economy is not ideal for the average Joe. I know a lot of people are killing it, but the average Joe is struggling. So what's going to happen here? What's going to happen? For those that have $60, $70, $80 copays, well, it's making it harder for them. But then there's all those people that have insurance that are no longer going to have insurance, and they're going to come to you for your self-pay rate. Do you think that's going to work? You guys, one of the things that I think is really important, I wasn't necessarily even thinking about this with the book, is thinking about what are ways that you can help people. And this is what I shared with those 2 clients that were here, this week. What are things that you're going to do to actually help and serve people if they can't afford your one-to-one care? Are you just going to give them the proverbial middle finger and say, too bad, so sad, can't help you? Is that what you're going to do? Or are you going to have another way to be able to serve them? Might look a little different because they can't afford the way that you're talking about right now. But do you have another way that you're going to serve these people? What are you going to do? Guys, I really want you to think about that. Now, it might be too late. I'm not sure if you will be in on time for this, but tonight at 8 p.m., I'm going to actually be doing it live. I'm going to be doing a class on the 3 income streams that you can go into 2026 with. And what I would highly advise you to do is to listen in on that. And if it's not me, listen to somebody. Have a way to be able to serve people that does not totally require you. And here's the problem of it requiring you. If it requires you, you have to charge a certain amount of money that a lot of people will not be able to afford. Now, you say you want to help all these people, and there are going to be so many more people for you to be able to help, but most people are not going to be able to help them because they are so stuck in the way that they serve people, to where the only way I can serve you is if you're physically in front of me. But then at the same time, we spent all this money, all this time, all this energy to learn something, and we feel like the differentiator between us and the non-professionals is our knowledge, but we're not willing to sell our knowledge. Make it make sense. I want you guys to think about that. I want you to think about the 24 million people that could potentially use your help because they don't have access to insurance anymore. Potentially 24 million. We know for sure it's going to be around 5. I want you to think about that, you guys. I want you to think about how are you going to serve people in a way that's a win for them, but it also can be a win for you. How are you going to create additional streams of service, which then creates streams of income so that people can get served and get help with your knowledge and your expertise? Something I want you to think about. And I would love for you to join the class. And if you don't join the class, I really want you to think after this episode, what do I need to do? What can I do to serve people that doesn't require them to pay what they would traditionally pay with your traditional services? All right. Love you guys. Till next time.